Thank you.
Hi. So I'm Deb Levine, and I'm the executive director and founder of ISIS. And first, I'm going to ask you a few questions. I noticed Josh had you waving your hands. Please raise your hands. If you've ever been a teenager. OK. Oh, good. Now, raise your hand if you know a teenager. OK. Raise your hand if you know a teenager with an STD. By the age of 25, 1 in 2 young people will get an STD. Young black women are 2 times more likely to be affected as young white women. 1 in 5 people in the US with HIV do not know they have the disease. Whoops. I need to go back. I didn't want to show you those pictures yet. Quite a few years ago, I was hired as a sex educator at Columbia University, and my job was to go out and teach young people how to put condoms on bananas. They really didn't care. So I was frustrated because I was being paid by the university. So what I did was I closed the door and I said, I know you have burning questions. I know you have questions about sexual health. And I'm not accountable to your dean, and I'm not accountable to your parents. So let's go at it. So the first question I get is, so I'm on Prozac, I take ecstasy, how will that affect my erection? I can tell you right now, I didn't know the answer. It was not at the tip of my tongue. But I knew I could do some research, and I could get back to that young person with information that could affect his lifestyle. But I did not have a confidential way to get back to him. And he had just disclosed to me that he had a mental illness, that he was taking recreational drugs and engaging in sexual activity. I looked around campus, and they were putting T1 lines everywhere. And I thought, the T1 line's the computer screen. There's something about the screen and the distance that it creates that allows you to have intimate conversations about sensitive issues in very safe ways. We've come a long way since Go Ask Alice. In 2000, oh, I forgot to say, that spawned Go Ask Alice, the first anonymous health question and answer service online. We've come a long way since Go Ask Alice. In 2001, I founded ISIS, which is a nonprofit that's designed to increase sexual communication and communication around sexual issues and reduce STDs. All of our projects have 3 key components that make them effective. It's the right people, right message, right channels. By right people, what I mean is we use I need to go back again. I keep showing you these pictures. So by right people, I mean we use epidemiological data. We follow the trends of how disease moves through communities. By right channels, I mean that we actually, see, I'm not in order today. Right people, right message, right channels. By right people, we're using our data. By right messages, we're actually going out and talking to people, whether it's virtually or in person. And we're having conversations with them to understand how that disease affects their community. And then we engage them in the solutions. By right channels, we then look at what's popular. And it may be evites, it may be text messaging services or social media. By any means necessary to reach those communities and engage them in critical health services. OK, so let me now give you the examples, and I'll show you those pictures. So this is one of our projects called InSpot. These are the right people. Rise in syphilis among gay men. Right message. Basically, men told us that when they got syphilis, they wanted to tell their partners, but they really didn't. And if there was an easy, convenient way to do so, they would. Right channel, we used e-cards. They send anonymous messages saying they may have been exposed to a disease, and then they're linked to testing and treatment services. OK, sex info, right people. Rise in chlamydia among African-American youth. Right message. African-American youth told us that they considered cell phones to be a private way to receive sensitive information. Right channel, text messaging, 160 characters where we can get across a nugget of information and access to youth-friendly services. And real quickly, I can't forget the underwear contest. This is called In Brief. right people, 15 years of abstinence-only education in this country, and our teachers are afraid to say the word sex in a classroom. Right message. Young people said they wanted their sex education from trusted experts, but they also want it peppered with gossip from their friends. Right channel, we did user-generated contest. In this contest, we asked young people to design a message of safer sex for a pair of underwear that would be the last thing before you got naked. We got 500 entrants and 650,000 engagements in less than a month. ISIS is not just me. We have 8 talented people out there. I started today with a provocative message, or provocative questions. And the reason I did that was to really show you that we're uncomfortable talking around sexual health and sexually transmitted diseases. I have an ask from you. I want to ask you to go to the young people in your lives, to spread the word about ISIS projects, and to impose upon them the importance of honest discussion around sex and sexuality issues. We also need help as a team around creating unconventional partnerships. We need to go out there, we need to scale and aggregate our projects, and we need to build our infrastructure. With your help, we can continue to be at the vanguard of right people, right message, and right challenge, and reduce STDs, increase sexual communication around the world. Thank you.
All right, thanks.
Oh, that's great.